If you're thinking about planning maybe a summer vacation, so in a few months, but you're wondering how you can do it as safely as possible, we took this question to our ABC 15 Health Insider team. Chances are you're aching to stick your toes in the sand, feel that ocean breeze whisk across your face, and jet off to your favorite destination. If you've been plotting a tropical escape in your head, you're certainly not alone. Earlier this month, the TSA said they screened more than 5 million passengers in a 4-day period, the most travelers seen since March of last year when the whole world was changing before our eyes. But how safe is it? Airports like Sky Harbor here are getting busier and busier, and we know that our summer heat is just around the corner. So more and more people are going to want to take a trip and try to escape the heat. Also, some airlines are requiring COVID testing. Some destinations require a quarantine period. All of this helps, but what do our ABC 15 Health Insiders have to say about it? Do you think it's a good idea?
Yeah, so I've been pleased about the drastic uptick in vaccinations over the past 2 months. I think we're actually at about 2.5 to 3 million doses a day. And I'm also really pleased to see that we've had a negative trend over the past few weeks of cases and hospitalizations. That being said, I want to remind everyone that we're still in a pandemic.
And because of that, Dr. Gupta says follow the CDC's advice and put off that trip, at least for now. But what about people who are already fully vaccinated? We've got more than 1 million here in Arizona alone. Does your advice change if, let's say, it's a couple who's both fully vaccinated?
Yeah.
Would you say they're allowed to travel or still no?
In theory, absolutely. But again, the CDC recently introduced guidelines about social interaction for those that were vaccinated. It was a real nice change to see that people that are vaccinated can hang out and interact with other people that have been vaccinated without a mask, or even those that are low risk, you can interact with those people without a mask. But they purposefully excluded non-essential travel, even for vaccinated people. And I'm going to continue to encourage everyone to follow the CDC recommendations at this time.
The CDC fears what they say is a clear-cut case of cause and effect. More travel leads to more cases.
And we've seen it time and again now over the past year. I mean, especially after the holidays and prior to that over the summer when we started seeing some more travel for summer break and things. And so we've seen this trend over and over.
But what if you have to travel? Maybe there's a family emergency, or you have to go for work, or maybe there's a socially distanced funeral you have to attend. In that case, Dr. Gupta says it's back to basics.
It's going to be your same precautions that that everyone's been trained to do over the past year, right? It's going to be social distance, avoid large crowds, especially indoors, mask in public, double mask if you're able to, and whenever it's possible. And lastly, make sure we have that snug fit, right? So you want to make sure that the mask completely covers the nose and the mouth, and there's no sort of air leaking when you breathe out.
And what about once you're on the plane? Should you be wiping down the seats and any other surfaces? Dr. Gupta says if it makes you feel better and you have the time, go ahead, do it. But he also warns that hand hygiene is much more important. So when you're packing, don't forget the hand sanitizer. Again, if you are in a situation where you absolutely have to travel. Our Health Insider team is here to answer all your questions. Email them to healthinsider@abc15.com.
All right, some great questions answered. Thank you.